Thank you, Natalie.
Yes, hi everyone. Oops. It's like, well, suddenly I speak really loudly, and that's normally not the case. Just like Georgie, I have a bit of disclaimer. I'm not a psychiatrist. I'm not a clinical psychologist. I am a researcher, and mostly I've done clinical neuroscience and clinical trials of children and adolescents with ADHD, as well as with adults. And this is mostly my area of expertise, but more recently I have also done some work on Fragile X and other genetic syndromes, and increasingly I've become interested about ADHD in individuals with Fragile X, and this is what I'm trying to do today, to tell you more about. But as Georgie said, you are the experts, you probably know way more than me, and if you have something to tell me, please do, because I will really appreciate that, and for my future research I would like to adopt as much of your expertise as I could do. And also I would like to say that what I've heard about your experiences with the system, it is very much the case with families who have children with ADHD only. So actually this is something happening across the board. And there's sometimes parents have to wait 2, 3, 4 years, although their children are experiencing substantial difficulties on a daily basis. So really, it's something quite common, unfortunately. And to tell you a bit about myself, I'm a research and teaching associate at the Child and Adolescent Psychiatry Department at King's College, which is Institute of Psychiatry, Psychology and Neuroscience. And I work in a team with child and adolescent psychiatrists who are experts on ADHD, and I've consulted them on what I'm going to present today. So some of what I'm going to present is based on their advice. My talk overview. First, I'll tell you more about what ADHD is and what we know from the literature, and then I'll move more onto ADHD and Fragile X syndrome, and then I'll talk about a few clinical recommendations and behavioural support for children and adolescents, as well as adults with ADHD, as well as individuals with Fragile X and ADHD. Okay, so what is ADHD? ADHD is a neurodevelopmental condition that affects brain development as well as behavior, and it's a persistent pattern of inattention and or hyperactivity and impulsivity that interferes with or reduces the quality of life. And here I'd like to stress that some individuals experience only inattentive difficulties, and other individuals experience only hyperactivity and impulsivity difficulties only, and some individuals experience both. The condition is more common in boys, often diagnosed in childhood and persists into adulthood. Here I would say it's more common in boys because probably it's more detectable than it is in girls, rather than that it's just more common in boys. But currently it's 2 to 3 in boys and 1 to 4 in girls in terms of ratio as it appears. And I've put some quotes what children with ADHD might often kind of have as an internal dialogue. Why can I not focus? Why do I keep missing things? Stupid, stupid, stupid. And sometimes they kind of compare themselves to other children. Why can I not read for 20 minutes like everybody else? And that can be quite a repetitive thing that happens for them. A bit about history of ADHD. I'd like to say that ADHD is incredibly controversial. And the first description of ADHD was as hyperkinetic impulse disorder in the late 50s. Although some clinicians and scientists would argue that medical descriptions of ADHD-like behaviors date back from 1902, and some would also argue that they date from 1777, but I think that's probably a bit too far. But anyway, ever since then, the interest in ADHD has been exponentially growing, and I would like to say that this is probably one of the neurodevelopmental conditions that's been the most researched of all conditions. There's so much research on the topic, it's mind-blowing, but it's surprising that things are still not as good and clear as I would like them to be. And I just did a very basic search in a medical journal, where I just put the word, just ADHD, not even the entire name of the condition, and I ended up with something like 46,000 results. So this is incredible. And you can see that most of the research is happening kind of in the last 20 to 30 years, so that's why I kind of taken that approach to say for the last 35 years of research. But please beware that I'm not going to present you with 35 years of research in a single talk. As I said, attitudes to ADHD are constantly evolving, changing. Sometimes trends are coming back, but for a long time, there would be kind of advocates saying that ADHD doesn't exist, that everyone is ADHD, somewhat ADHD, that children are necessarily medicated, that we shouldn't be doing what we're doing. This is probably because ADHD is actually a collection of behaviors that are on a continuum. And every one of us is somewhere out there in terms of these behaviors. We are all somewhat unattentive. We are all somewhat hyperactive and impulsive. But what we are thinking of as ADHD is those individuals who are at the very, very far end of that distribution and who really struggle in their daily life because of these behaviors. And that is not to say that ADHD doesn't exist as a condition, but is to recognize that individuals who are that far end on that distribution may need support, because it's not as simple as just telling themselves to sit still or pay attention. And nowadays, it's kind of becoming more and more trendy on TikTok, people to post short videos about ADHD and management of ADHD, and it's becoming increasingly awareness of actually ADHD, of women with ADHD has become really, really big. Also, often in the US, people are kind of blamed for unnecessarily medicating children and kind of making ADHD popular as a trend just to sell medication. And then there's also other things about TikTok trends, or the pandemic was behind the rise in ADHD diagnosis. So often society feels really strongly about ADHD, and the news constantly flying around all the time. And again, my favorite, ADHD doesn't exist. Okay, so how common is ADHD? ADHD is incredibly common. It is the most common neurodevelopmental condition, and it can affect 2 to 7% of children and young people globally. And very clever people from all around the world have collected evidence from different countries, from New Zealand to India, to see whether this kind of occurrence rates vary from country to country. Is it something about society, or is it that actually this occurrence of ADHD is actually relevant and valid? And what they found that from country to country, things were relatively stable and uniform. So actually, it's not about just cultural differences or society attitudes to children's behavior. This is another important thing that was kind of only recently recognized, that additional 5% of children and young people also experience substantial difficulties with overactivity, inattention and impulsivity that are just under the diagnostic threshold, and often that is a barrier for them to access support. 2 to 4% of adults also have an ADHD diagnosis worldwide. And now you might wonder, okay, so if someone has ADHD as a child, what happens then when they grow up? Why the kind of all of a sudden the rates drop? And it's probably because we don't know enough about ADHD across the lifespan and about ADHD in adulthood. One of the reasons probably is that as children grow older, they become less hyperactive. So there's actually that disruptive behavior that often prompts diagnosis is no longer present. And also what people tend to experience is actually greater mental restlessness, something that is much harder to quantify, much harder to detect, and much harder to be worthy of support because it's not disrupting other people in a way. Probably that's why the rates are lower. It also might be that often diagnostic tools are designed for children. So when actually people grow older, they move from their local institution to university or go somewhere else, or whatever happens, that transition breaks their care. They often fall through the system, not receiving any support any longer, and really things start to go downhill. And they would often, it might be a case that they've remitted from ADHD, but it's not always the case. And as I said, ADHD is the most common neurodevelopmental condition and the most common reason for referrals to psychiatric, educational and medical services. And what might happen if we have someone with Fragile X, for instance, but it's not known they have Fragile X, they might initially present as someone with ADHD and actually be referred for ADHD initially. So the causes of ADHD, unlike Fragile X, ADHD is not a single gene condition. There's not a single gene or cause that is associated with ADHD. It is highly heritable, 70 to 90 kind of estimates from genetic studies from the center I'm based in. And by heritable, we mean that the way the behaviors present, they kind of carry over within a family and can be expressed in a similar way. And often families who have one child is diagnosed with ADHD, often their siblings might also be diagnosed with ADHD. However, the origins of the conditions are very complex, both genetic and environmental. So that is another area of controversy, but there's a few environmental factors that have been associated with an increased likelihood of being diagnosed with ADHD, such as exposure to cigarettes and alcohol during pregnancy or other substances, preterm birth, and also, I don't know if you're familiar with this, probably you are, but there was a big study on Romanian children taken from orphanages in Romania who've experienced severe early life deprivation. And actually a lot of these children were then studied at the institution I'm based in and other institutions across the UK, and a lot of them actually were diagnosed with ADHD, autism, and a cohort of conditions. And it kind of also that was kind of prompt clinicians and researchers to think that there might be a causal role for severe early life deprivation for these conditions, in this case ADHD. But most scientists kind of agree, maybe some disagree, that ADHD is the result of the small effect of multiple genetic and environmental factors which could vary from person to person. And recently there's been a very large genetic study done as a part of a genetic consortium where they had 55,000 individuals to kind of try to understand genetics behind ADHD, and they've identified 12 genetic loci associated with ADHD, but again, there's not a specific cause and nothing is confirmed just yet. So how can I tell if my child has ADHD? So often children who have ADHD would make careless mistakes most of the time. So that is not just every now and then. It would be, let's say, 75 to 100% of the time. Difficulty sustaining attention on tasks, any task, even tasks they really enjoy sometimes. They may seem like they're not listening, they may have difficulty following instructions, they may have difficulty organizing tasks, even tasks they enjoy. They may dislike tasks that require or avoid them, or be reluctant to engage in tasks that require sustained mental effort or attention. They may be easily distracted, just a buzz of a fly or a slight noise or someone passing is enough to take their attention. They can easily lose things, and by losing things it's not once a month you forget where you've put your keys, but consistently forgetting their school books or forgetting their pencils or forgetting important stuff, keys, etc. And they can be forgetful in daily activities, all sorts of daily activities, even something as simple as brushing their teeth every night. It might be something that children forget to do or find effortful. Children might also have, children with ADHD, if they're also hyperactive and impulsive, they may fidget a lot. And by fidget, I don't mean just rustling a bit for some time when you're bored, but all the time, to a point that they even feel fed up with fidgeting themselves. They may leave their seat when it's inappropriate, run or climb excessively, or when, as people grow older, they may feel restless. They may not leave their seat, they may know that they shouldn't do it, but within themselves they may have the urge and the need constantly to leave their seat or to move. They may seem like they're constantly on the go. So like you see them here, and then in 1 second they're over there, and it's just dotted around. They may have difficulty playing and engaging in leisure activities quietly, and that often changes with age. So it might be not the case that they cannot be quiet, but it might be hard for them to engage in leisure activities for sustained periods of times. Blurt out answers before questions have been completed, difficulty waiting their turn, interrupting or intruding on others, and some children may talk excessively as well. Okay, ADHD diagnosis. There are, normally it's the diagnostic, kind of American diagnostic manual is used called the DSM and criteria, and it's constantly reassessed and reevaluated over time. Kind of the most recent revision included a few things, but kind of the important thing is that the number of symptoms for adults and adolescents was reduced from 6 to 5. And this is because often adults present differently, and they may not be running and climbing about or talking excessively, but they still experience that restlessness, both physical and mental. For children, is the presence of 6 or more inattentive behaviors and or 6 or more hyperactive and impulsive behaviors. And for adults, 5 or more, exactly the same way. But as I said, it could be the combination or just one or the other. These sort of behaviors, also clinicians call them symptoms, must have been present for at least 6 months and be developmentally inappropriate. So if a child is 3 years old and is running about, not quite focused, then really that is kind of considered developmentally appropriate. But if someone is 15 and they're moving about all the time, completely restless, cannot sit still, then that might be seen differently. There's some additional criteria, so several behaviors must have been present before the age of 12. Several behaviors must have been present in 2 or more settings, and often actually teachers are involved in the diagnostic process to provide information. Behavior should interfere or reduce the quality of life, and this is actually one of the most important criteria, that children and their families should actually experience difficulties in their life. And the behaviors are not explained by any other conditions, in particular mental health conditions such as anxiety or any kind of other mood dysregulation conditions or during a psychotic episode, etc.
Because ADHD could be explained by fragile X.
No, I don't think it's been included. I haven't seen it, no. I think it's mostly, what they really, what the criteria focuses on mental health conditions primarily, rather than any other conditions. Because because all these things are behaviors, and behaviors, the different conditions show a lot of overlap. So if someone is assessed for depression, let's say, they often will be asked, do you struggle with concentration? And the answer for the particular person when they're depressed is yes, I struggle with concentration. But that is very similar to what the question for ADHD would be as well. So it's really kind of trying to, what this particular item is tapping at, is it ADHD or is it something else that is happening? Like, can something else happening explain what is happening for the particular individual? And of course, often it could be that ADHD is co-occurring with depression. Because if you're completely overwhelmed by the world, most likely is that the mood will be impacted as well. But then it is a matter of, was it the inattention, hyperactivity and impulsivity coming first, or is it that the mood, difficulties with mood came first? So that's why it's in a diagnostic setting. That's why it's very long, because there's a timeline and the behaviours are tracked, and it's it's a lengthy process just to try to unpick what is really happening for the individual. Okay, so often also children with ADHD, they're not often offered this, but it would be good if there are, and it varies from different areas. For some areas they are offered neuropsychiatric or neuropsychological assessments. In other places they're not, which is surprising. But there are a number of areas of interest for this assessment. So it's general intellectual ability, also known as IQ, Attention is also assessed during this assessment, and this is often something that comes up for children with ADHD. Inhibition, or ability to stop yourself from doing things you don't want to be doing. Executive function, so this is our kind of abilities to plan, to manage our time, to self-monitor, to organize things. And often it can be affected in ADHD, but not although I've said that children can have problems with planning and organizing, etc., the executive functions is often an additive to what is already happening. Not all children with ADHD will have problems with all of these things that are listed here, but it's very common. Then this assessment can include memory and all different types of memory, language assessment and different aspects of language, visual skills, again, different aspects, academic attainment, emotions and behavior assessment, social functioning, and adaptive functioning. And now you might wonder, okay, does a neuropsychiatric or neuropsychological assessment make the diagnosis of ADHD? What is useful for? Why would I consider doing that with my child and not just off I go with the diagnosis? So a neuropsychiatric or neuropsychological assessment does not make yet the diagnosis of ADHD, but it can be very useful in telling us about each individual's strengths and challenges, and also help you understand, okay, my child has ADHD, my child has Fragile X, but they still have their own strengths. They still have things, because you can see the list is very lengthy. It's like 11 items. They still have their individual strengths and challenges on this list. And once you know their strengths, you can then use them and harness them to help them cope with their difficulties. And actually, you might say, okay, children with ADHD often have difficulties with working memory, but that might not be necessarily the case for your child. And it's really important you know this. Often these things are done in a way that they're plotted and in terms of the normative data. So what is like on average in the general population. Do not be discouraged by this, below average, high average, etc. Just focus on your own individual child and what their strengths are when you go through these things. And I know we've said that parents often have to advocate for their children, but if you can do that, I think a neuropsychological assessment can be really, really helpful. Can tell you a lot. And most importantly, it'll tell you what your child is good at, because it's not always good to focus on what children are not good at. So another thing probably you're thinking right now, and other people are thinking, is my child struggles with sustaining attention, shall I always assume ADHD? And the answer is definitely no. Because the behavioral difficulties we see as inattention may not be related to ADHD. They may not be ADHD. There may be a whole cohort of reasons and causes within the individual itself why they might be experiencing inattention. So they might be in pain, as Georgie pointed out in relation to sleep. They may have low mood, they might be high on anxiety, they might have other things going on for them. So it's really important that we understand why the child is inattentive, because what might come as inattentive and otherwise dysregulated behavior might telling you, Mom, my tummy is really, really painful. I cannot focus on this because I have bigger things going on for me at the moment. So it's really important that this is considered. And the pain can be chronic, and it might seem that inattention is also chronic, so therefore ADHD, but it's not always the case. For that reason, a comprehensive assessment as well as understanding of the child or the young person are absolutely essential. Because, as I said, these are behaviors, and these behaviors are common in the general population. So I wanted to, I've talked to a lot of individuals with ADHD, some had Fragile X, some didn't, and kind of asked them what it's like for them, the world, how do they experience it, what happens in their head. And people often tell me that they find it hard to filter out sounds, smells, and incoming information. And just like this notches I've listed here, sometimes it might be multiple things coming at them at the same time. Imagine if you have 9 radio stations all playing at different frequencies, different information's coming up, and it's all coming into your head. And you try to filter this out, but you can't. That can be really frustrating and difficult. People also with ADHD don't feel stimulated enough most of the time. And we know that from also physiological measures we've done, such as measuring the skin conductance rate and sweating and brain measures and EEGs, and we know that that is the case. People feel understimulated and their brains are understimulated as well. People with ADHD find it hard to transition from one task to another, and it can be an absolute nightmare for them, especially when they're resting, they're having a break, and then they have to switch to something that requires their attention. And that is when actually people with ADHD feel most vulnerable. People with ADHD find it hard to stop certain behaviors, so it's not just a matter of willpower, it is just some, even at subconscious level, things that are happening for them. And also managing the efforts. Sometimes it might be that too much effort is applied and sometimes too little effort is applied for the particular context. And that can be hard for people to understand, because people will say, okay, but you are very, very active for this thing, but now all of a sudden you're very withdrawn for this other thing. Because it's a matter of that regulation that can be hard in the context. People with ADHD might be most people tend to be very sensitive to rewards to remain motivated. And this is actually something that we found to be relatively specific for people with ADHD. So they need immediate rewards to keep going and to sustain their motivation. And I'll come back to this later on. And another thing that is a lot of my PhD are kind of focused on understanding this is that both children and adults with ADHD experience excessive and constant mind wandering. So what happens is their thoughts are constantly on the go, jumping from one topic to another and multiple thoughts at the same time, which if you imagine yourself, that can be very stressful for someone, can impair sleep, can impair performance at school, can really lead to all sorts of consequences for the individual. Okay, so I said you all the things that people with ADHD find hard, and that might be a bit discouraging, but there are also other positive aspects of ADHD, which people from my institutions, and actually I'm very proud to say that people with ADHD carried out research on positive aspects of ADHD, and I would like to share some of them. So people with ADHD are curious. They approach the world with childlike curiosity, and they're often very adventurous, compassionate, they're calm in crisis, they're creative problem solvers. They might take a long time to get to a problem, but sometimes taking that long time may be actually really creative and useful. They're energetic. And also another thing about ADHD that often people don't mention is that people with ADHD can hyperfocus, so they can focus on something that they're really, really interested in and even forget to eat and sleep, which is maybe not so good, but it can be helpful. They're humorous. They really have a witty humor that can be very engaging for people, and a lot of comedians and sports people have ADHD. They're creative. They have business skills. They know how to kind of take risks. Wisely, sometimes. They have good imagination, and some people with ADHD can actually enjoy acting a lot and go into almost like their own world of imagining scenarios and different films and things happening. And maybe if your children have ADHD, you might have noticed that their imagination is great. Personally, I love children with ADHD because they really make me laugh a lot, and they make my day so much better. They're entertaining and intuitive, and I would say that I've worked with children with ADHD for a long time now, and I absolutely love it. A bit more about ADHD and Fragile X now, and why actually I've become interested in Fragile X. When I was a researcher, almost 10 years ago now, we were looking for children with dyslexia, and what I noticed that a lot of the children that were coming to us were having difficulties with attention. And then I asked back then the person who was my supervisor, how come we are looking just for children who have learning difficulties, but somehow they never just come with learning difficulties. There's always something else happening. And then maybe we should assess them for their attention. Maybe we should think about other things. And then I became interested in ADHD. And then I noticed that also children who are inattentive have learning difficulties, but there's something else happening for them as well. So then I said, don't have the full picture. We have these children, and they come with, they're so diverse, they're so different, they have different needs, different things happening for them. How can we do things better? And then clinicians at GOSH, which is Great Ormond Street Hospital, at UCL, told me about Fragile X, and ever since I've been interested in Fragile X and ADHD as well. So ADHD is more common in people with Fragile X compared to people without Fragile X, or people with other genetic syndromes or intellectual disability without a known cause. And that's why I think it's so important. And the occurrence rate, remember what I've shown you for the global rates, 2 to 7%, well, for people with Fragile X could be 30 to 74% in childhood, which is really, really high, and 42 in young adulthood. And this is based on the DSM criteria. Of course, if different measures are used and different approaches are used, these figures may vary. Sometimes they can be higher, can be lower, but really it depends on the approach. And this is mostly data from the US. Often ADHD in Fragile X becomes more apparent in middle childhood, very much like for people who don't have Fragile X. And again, research says that ADHD is also more common in boys than girls with Fragile X, but as I said before, probably because it's just more detectable. That's why it's the case. Probably the prevalence rate is similar if it's considered that girls might experience ADHD differently. Also, research is kind of showing that people with Fragile X tend to have an inattentive type of ADHD, and hyperactivity and impulsivity may often improve with age. And this is quite important, but having said that, when I looked at the percentages, I would say that people with Fragile X who have the combined type or the impulsive and hyperactive type is very similar to the inattentive type in terms of percentage. This is quite an important element now, that children with Fragile X who are more inattentive, because it might be the case that someone had, although it is so common, it is also very likely that someone with Fragile X doesn't have ADHD, but those who have ADHD as well and more inattentive tend to experience more social isolation, anxiety, depression, and educational difficulty at school. Actually, the additional impact of ADHD can have more serious, quite a lot of consequences for the children and for the young person in general. This is very important here now, that a more pronounced intellectual disability is not associated with the presence or the severity of ADHD, which means that someone with Fragile X who has very mild learning difficulties or not at all may have very severe ADHD, and actually ADHD might be what is mostly impacting the quality of their life. And it might be the other way around. Someone who has more pronounced learning difficulties might not have any ADHD-like behaviors at all. So that's why I want to stress here that the presence of intellectual disability does not equal ADHD behaviors for all people. Also, I'd like to stress that diagnostic tools may produce different outcomes, and people in this country and in the US and all over the world are trying to find the right measures to capture and understand ADHD and Fragile X, because currently most measures are taken from people without Fragile X, and they're often not, sometimes they're not useful. They're simply not good enough, not sensitive enough. And this is again US data, that 30 to 50% of people with Fragile X and ADHD are treated with stimulant medication with moderate to large efficacy. I tried to look at UK data and it was quite tricky. So maybe if someone else has the UK data, they can let me know. Okay. So a bit about treatment recommendations for for ADHD, and this is, as Andy mentioned earlier on, the National Institute for Care and Health Excellence in the UK. It's done in kind of ages, so children under 5 years. For them, it's recommended an ADHD-focused group or individual parent training program and or behavioral approaches as a first line of treatment. When medication is necessary, opinion from multiple clinicians is needed. For children aged 5 years and over and young people, as a first instance, again, information about ADHD and additional support to parents and carers, and a cohort of behavioral support approaches. However, if none of them are useful, even when environmental changes have been adopted and behavioral strategies have been implemented, then the recommendation is for medication. Here, I would like to stress that although these recommendations exist, parents often don't report having that support with their children. And for adults, again, to offer medication, and often for adults actually, medication is offered as a first line of treatment as well. For both adults and children with more pronounced difficulties, so those individuals who really struggle to do basic things on a daily basis and they find life very, very complicated, clinicians usually recommend a comprehensive multimodal approach, including both pharmacotherapy and behavioral support for effective treatment and support, which would mean behavioral approaches and medication. So a bit, maybe now you wonder, okay, if medication is so mentioned in ADHD, is it effective in any way? So based on a wide range of scientific and clinical evidence, and what Georgie mentioned before is called meta-analysis, done by someone, a child and adolescent psychiatrist called Samuel Cortese. Maybe some of you have heard about him. He's collated the evidence. It took him more than 5 years to do that, and it's virtually every single paper that's been published on using stimulant medication for people with ADHD with various additional conditions was concluded that methylphenidate, or this is a stimulant medication, an active ingredient, maybe commercial names you've heard is Ritalin or Concerta or Medicanet, maybe the most effective treatment choice for children with ADHD, whereas amphetamines may be better for adults with ADHD. All types of stimulant and non-stimulant medication, and I've listed a few. These are all active ingredients rather than commercial names. Improve ADHD behaviors in children with ADHD compared to placebo. By contrast, just some of these medications improved ADHD symptoms in adults compared to ADHD. However, people with Fragile X tend to not tolerate stimulants very well due to common side effects such as anxiety, irritability, frequent mood changes. Some people also might experience more medical-like difficulties. And this is the case also for people without Fragile X who have only ADHD. They also can experience impairing side effects and find stimulant medication only partially effective or not effective at all. In such instances, non-drug treatments are often sought out. And another trend that I noticed from talking to people in our South London and Moseley NHS Trust, I'm an honorary researcher there, and I often talk to people who are on the waiting list and sometimes even take part in diagnosis and help out with things like that. Parents often express a general preference for non-drug treatment support in the first instance. That's also my observation from my own research as well, and what I've seen in a clinical setting as well. And often children don't want medication themselves either. So what are the behavioral options? So there's something called psychoeducation for ADHD, or these are forms of psychological programs which are designed to educate children and young people and parents about ADHD. Such programs increase the knowledge of ADHD, improve the quality of life, improve adherence to medication, psychological well-being, but they don't always improve ADHD behaviors, especially for those who really struggle. There's also cognitive behavioral therapy for ADHD. It's offered at our institution as well. And it's often good in terms of reducing anxiety and depression, but it doesn't always help with ADHD-related behaviors. There's also dietary and exercise programs, and they do tend to have effect on ADHD behaviors, but they tend to be very short-lived and short-lasting. And often exercise is quite helpful, but the effect is only half an hour after the exercise, and then it's kind of gone, really. And then cognitive training has become incredibly popular, and there's also evidence has been collected to see how cognitive training affects ADHD behaviors and improves cognitive skills, so improves working memory, improves other types of memory, but it doesn't always improve ADHD behaviors. Mindfulness, which is a meditation-like practices, seems to be a promising approach, which tends to reduce ADHD-related behaviors with a similar effect to medication, but still medication has larger, still the effect of medication is larger. There are different types of neuroback, which is a form of attentional training using one's own brain waves to kind of feedback, and different types of brain stimulation targeting key ADHD-related brain areas, often kind of the very frontal bit of the brain. They show promising results, but again, the effects tend to be smaller compared to medication. So really, no other treatment has exceeded the effect that medication has. So some behavioral strategies and support for people with ADHD, which can also be applied for people with ADHD and Fragile X. Just to say that the aim is not to cure someone of their ADHD or to eliminate ADHD, because that is unrealistic, and also is probably not a very helpful approach of thinking about ADHD, but it's more about how an individual can be helped to harness their behavior and kind of work towards the advantage rather than in a disadvantage. So another thing is, first thing is allow regular breaks to prevent burnout and tantrums, because the ADHD brain is always stressed. So imagine when you feel stressed, everything feels too much. Well, that's how the world is experienced for someone with ADHD. Allow your child the opportunity to move, especially when they say or show that they need it. So if you try to restrain someone from moving and constantly sit still, sit still, sit still, after some time there will be a massive explosion. Also, a simple solution to this is just skipping or bouncing on a ball briefly but regularly. And you can increase the timing that they need to bounce or skip every time. So initially they can be allowed every 10 minutes, then every 15 minutes, then every 20 minutes, then every 30 minutes. But when they know that the movement is coming, can be really helpful. Use visuals, use flashcards, pegs, figurines to aid attention and retention, and use different ways of methods, and learner knows best. So if you know that your child learns and remembers and sustains their attention in a certain way, utilize it. Break down instructions, and again, visuals can be very helpful, and something that maybe seems very simplistic, but simply ticking things off a list can be incredibly rewarding for someone with ADHD, and actually helpful for them to see these particular activities as separate rather than as one. And use multiple ways to give instructions: verbal, visual, technology, whatever it works. Encourage a routine, because children with ADHD and Fragile X, we will struggle to follow a routine, but also allow for flexibility and some level of disorganization, because it will be, sometimes it might be, certain situations, it might be unrealistic for the children to be sticking to that routine. Not about bed, but other circumstances, it might be really important, because if someone is fixed onto a routine, it might be too stressful and actually have an adversive effect. Allow fidgeting with an appropriate object and help your child learn how to fidget without disturbing others, because often fidgeting is disturbing to others because it can be loud or it can be not at the right time. So for instance, squeezing a stress ball quietly under their desk at school or something else they can squeeze or fiddle with can be a simple enough solution and effective, and something they can go to when they need it as well. And also they feel more in control knowing that they have that fidgety thing they can play with rather than just relying on being allowed to fidget. As back to rewards, use immediate rewards to sustain motivation and performance. If you promise a child with ADHD an ice cream trip next weekend, probably they will forget straight away, and it may not work whatsoever. However, if you offer them a quick iPad game straight after the effort for activity, like doing homework, it may really do wonders. So it might be also a case of negotiating. Okay, now we do 10 minutes of doing your homework, and now we have the iPad for 5 minutes. And then they can also learn to do them themselves, and after some time, they will just do their homework, iPad here, and then just stop homework, take the iPad, and you can even have one of these hourglass clocks that they can actually operate themselves. And that is kind of important thing about all these strategies. Try to empower your children to become managers and kind of to self-monitor and manage their own behavior and to find their own strategies rather than them relying on other people to manage them or help them. And some children with ADHD will need to self-stimulate because, as I said, children with ADHD feel understimulated. So allow self-stimulating humming, drumming, tapping. So I often have participants who come to our office, and the first thing they do is, and they're like, "Do you like my music?" Yes. And help your child engage in such behaviors without disturbing others. So it might be the case that if they want to really hum a bit more loudly, they can leave the room for a bit or do it quietly. Or another thing that some of the children I see is imagining in their head that they're drumming or tapping. Even that sometimes can be very helpful for them and stimulating enough. I know that sometimes that can be very tricky and very hard, but try to create a distraction-free environment at home. So, for instance, one device working at a time and less toys. Children with ADHD are often indecisive and struggle with choice. If they have a lot of toys to choose from, or a lot of activities, or loads of different devices are working at the same time, it will really be like an explosion in their head. A simple choice, this or this, can really do wonders. And I think that's for me, probably that's the most important. Help your child practice self-acceptance and self-compassion. So see ADHD as just one aspect of their behavior and learn how to harness it. And self-acceptance really starts with you accepting them as having ADHD and Fragile X to start with. But really self-acceptance is not just taught with words, okay, now I'm teaching you self-acceptance, but teaching one to be kind to oneself. You can't focus today. That's okay. You can only focus for 10 minutes. That's fine. Tomorrow we try 15. Next day we try 20. Okay, you struggle to sit still. Okay, today you sit still for 5 minutes. Tomorrow maybe 10. Next day maybe 5 again. But to see ADHD not always as a disorder, as a problem, but also as part of one's really identity in a way, and something that can be worked with and modified and helped with. And I would like to say that try mindfulness. If you haven't heard about mindfulness, try mindfulness. It can be as simple as focusing on a raisin for first 10 seconds, 20 seconds, 30 seconds, just exploring the raisin, how it looks, how it feels, how it smells. And then it can be next day longer. It can be something else that the children are interested in. But try mindfulness. It can probably most likely will make a difference. Personally, I practice it, and it does wonders for me. And if all behavioral strategies or approaches do not help, no matter what you try, how committed you are, for how long you've done it, please consider consulting a psychiatrist, clinical psychologist, or other ADHD specialist again. Hopefully, someone who understands both Fragile X and ADHD, best case scenario. to find the best way to support your child all together. And really you can do wonders that way. Thank you, everyone.